All right, we're live. All right. Hi, everyone. This is Dr. Ola Benton. I help people live long and well because I believe the quality of life is just as important as the quantity of life. And I be honest with you, I am super excited because we have multiple guests, all like it's like three for one today. And we're talking about the role of physical, occupational, and speech therapy in seniors aging in place. I'm so excited to have you all here. But before I go ahead to introduce you guys, I kind of like to talk about why we're having this conversation. I'll be honest with you, between the children of parents who are aging and are struggling to maintain their independence, and they have to manage the parent and their children and the business of life, and the parents not happy that they're losing their independence and having to move in with family members. This conversation needed to happen. Okay, how can we help our seniors maintain their independence in a way that's safe for them? And so that's why we're here. So yay. Now we have 30 minutes, so I'm going to have to go really quickly because I want each of you to introduce yourself, who you are. So I'm going to start with you, Miss Mercy. Who you are, what you do, and then you can introduce the rest of your team. Does that sound good?
Absolutely.
Girl,
So my
you're
name is
looking
Mark.
good. You look, I'm just saying, you look good. I'm sorry. All right, go ahead.
Okay. So my name is Mercy Efuwape, doctor of physical therapy. I've been a therapist for 12 years and just have had the pleasure of getting to work in different settings. But recently, I'm joining with these two professionals as well and business owners. Nadia is occupational therapist and Jenny is a speech language pathologist. So you two introduce yourselves as well.
Good evening, everyone. Thank you for having us, Dr. O. My name is Nadia, and I'm an occupational therapist, and I'm honored to be here, and I'm honored to work with Mercy and with Jenny.
Yes, same. Thank you for the introduction, Mercy. So I am the speech pathology sector of the mobile outpatient bunch. Nice to meet all of you.
All right, awesome, awesome. So, Mercy, I'm going to have you talk. I always like to ask, why do you do what you do? What's the story? We'll try to make it brief, though. Why
I'll
do you
make
do
it
what
brief.
you do? Okay.
So I became a physical therapist out of a passion of just working like hands-on with people. So looking at all the different healthcare professions out there, physical therapy was just so fun because you can work with all age groups and really hone into improving the quality of life and improving function. So that was just really interesting to me, and it's been fun over these 12 years getting to do that.
I could tell you love doing what you do. So
I
this is
do.
awesome. And then next would be Nadia.
So I have been an occupational therapist since 2015, so almost 20 years going towards that. And I originally was a child development major, thinking that I was going to be working with peds. We do something in peds called working with the whole child. And I found after I graduated that I really enjoyed working more with adults. And the transition is about the same. It really is, from one side of the spectrum to the other with adults and kids. And that is addressing the whole person. So I have a heart for serving people and walking with them along their healing process. And so that's why I'm here.
Awesome, awesome.
Yes, and to piggyback off my friends here, my background is as a speech pathologist, but the bulk of my career has been in operations, overseeing therapy in various facilities. So assisted living, independent living, skilled nursing facility, everything through that transition home. So over the years, there's been a lot of changes in the industry, and there's just that need has grown with people aging in place, like we're talking about here today. And so this the reason we have these three business owners here today is because we all kind of found that niche in understanding where home health may not be able to continue in certain instances. We're able to jump in, and so it's really cool because we can develop those individualized plans of care from very low functioning patients all the way through high functioning patients, and order equipment and get outside resources involved, and it's super impactful. So having parents in the healthcare field and then getting into it myself, that's how it all began.
All right, awesome, awesome. I'm glad to hear that. Now, my next question would be, what is physical therapy? And you could also chime in, occupational therapy as well as speech therapy, and how does that help to maintain a senior's independence and mobility? And I'll tell you why I'm asking this question, because some people are probably asking, this sounds like more work for me to do. When I have patients, you're going to go for physical therapy, they're like, oh man, they're going to make me work. So can we speak to what's in it for them,
Yeah,
and then we'll
absolutely.
go from there.
So what's in it for them is what we get to do is in the evaluation process, we get to hone in on what's very important to them. So we're asking, what are their goals? What is the family goals? That's when we get to make it all about them. So if it's they want to continue doing a certain activity, whether it's yoga or walking or cooking or, just the different things that they enjoy or what they're noticing that they're having a hard time enjoying, all of us disciplines separately and together get to work to make it all about them. So, in the sense of being able to stay age in place, remain at home as they age, we look at the whole picture of safety. We're looking at their balance and coordination. We're looking at what equipment do they need. Those kind of things are what we get to look at and work on when we assess in home.
All right, this is awesome. And I like the in place piece, because when you're in the house, you get to see what they can use, right?
Mhm,
You can see
mhm.
what's potentially an issue or could pose a threat to them. So for those of you who are watching who are like, you know what, my mom could use more help. I'm concerned she looks more like weaker than she used to be, because sometimes you don't notice because you're far away. There are options. So that's what this discussion is about. So let's talk about exercises from a physical therapy standpoint that help improve balance and prevent falls in older adults. I don't think you can go through everything, but maybe you could talk about why those exercises are important to improve balance. Like, who cares about balance? What's with balance?
Yeah. So physical therapy, looking at let's just say walking. Of course, you need to have good balance to be able to walk everywhere, whether it's to the bathroom or outside to the mailbox or to the car to get to the doctor's appointment. So, looking at overall balance, we work on gait training, working specifically with how you're moving your foot. We're looking at improving balance with footwear. We can look at what shoes they're wearing, what shoes they should not be
Mm,
wearing,
mm.
the devices that aid in balance, and then of course specific exercises that we can use to address the balance as well. I feel like I'm
Awesome.
talking a lot, so Nadia, maybe you
No,
jump in.
I'm gonna have a
Okay.
question for you. Don't worry, I got an idea. I got you. I got you. Now, I want to know, people tend to say, well, I'm balanced, but, or I'm doing fine, but you see them, kind of looking at the floor when they walk, right? So
Mhm.
staring, and then having to use things to support. So could you really just real briefly talk about what are cues for someone, maybe say a child or an adult child looking at their parents, to kind of watch out for, like, you know what, I think my mom needs more help than the obvious. Obviously when someone's about to fall, but
Right.
there's some things that you can kind of tell, like, you know what, you could use some of me. Go ahead.
Absolutely. So we're looking at their posture, just like you said, if they're looking down all the time or walking real slow and furniture walking or holding onto the wall while they're walking. So those are cues that say, okay, I'm not using all of my systems well to do it on my own. So I'm looking for all this external support, whether it's increasing vision by looking down or counting on the walls for some balance, external balance,
Mm,
or even footwear. If you're noticing that the way that their foot is maybe shaking or rotating out because the shoe wear is not giving good balance. Those are things that we can see from the outside that are maybe hard for a patient or the aging parent to see on their own. Yeah.
okay, awesome. All right, Nadia, over to you. So I'm going to ask, occupational therapy often focuses on daily living activities. um, Sometimes, I've gotten pushback, things like, no, I didn't have a stroke, I don't need that, or I know how to take care of myself in my own house. Now, why would someone say, you know what, I need to come work with you? How can you assist seniors in maintaining their abilities, their ADLs at home?
So I first want to just talk about the fact that ADLs are centered around people remaining functional. And when I say
Mm,
functional, being able to take care of yourself. And there's another myth, oh, occupational therapy, upper body, and all the things. And it's just a really lazy answer to kind of separate OT from PT.
mm,
Um, but in reality, we want to help a patient, which is your first occupation, is always yourself. And so that's really what occupational therapy is, your first job, taking care of yourself, which is meaningful to everyone. When someone steps in and they start doing everything for a person, it starts to do something to your spirit. And
mm,
so, in a lot of cultures, the big thing that we do is to honor and reverence our parents as they age. So we want to step in and take care of them like they've
right,
taken care of us.
right.
Sometimes we can be overstepping and doing everything for them. And then they end up not being able to remain functional because now we're doing everything. So the real goal is to bring some balance to that, to reverence them as our parents, but to also be a respecter for them as a person, to
Mm,
want to encourage and support them to remain functional. And that's what occupational therapy does. We come in, we help with adaptive techniques, with
mm.
dressing and bathing and grooming, putting safety in place to do fall prevention, helping people get in and out of the bed on their own, go to the restroom, putting them on bladder schedules, all type of things to help them remain in place as they age.
You mentioned something very powerful, and I wanted to emphasize that because I see sometimes, when I see the adult child and the parent, and I could see the countenance of the parent, like the elderly, right? Depression sets in. They feel like a burden. It's the same conversation over and over again. But then the adult child's like, no, I got to take care of you. I don't want you to fall. So I got to do this. I got to do that. But what's happening is that loss of independence affects them even psychologically. So
Absolutely.
that's a very, very important point because when we talk about quality of life, how well our parents live, they want to be cared for, yes, but they still want to maintain that level of independence because it's their pride, it's a sense of joy, it's a sense of, I got this. No one wants to feel like a burden. So this conversation needs to be had, and I'm hoping that the adult parents who are watching or adult children that are watching this see that side because sometimes it can cause strife between both parties, and they're both working for the same goal.
Yes.
Now, my next question for you is that, and of course, I'm sure you can't answer this to a broader, to a specific point, but are there any modifications or adaptations that occupational therapists commonly suggest for seniors' homes to enhance safety and convenience? So we know we have to get the one for the specific patient, but generally speaking, any tips? Right.
Absolutely. Shower benches or shower chairs. Putting night lights in the bedroom because most people as they get older, they have to get up and go to the restroom at night. So putting night lights in the bathroom and in the bedroom so that they can see when they get up. Some people would probably benefit from a urinal being there or a bedside commode. Um, Grooming sticks to help you put your clothes on. They've got sock aids. They have all type of adaptive things that we can help patients continue to be functional and independent at home.
All right, so I got a hiccup for you, and I call them hiccups, meaning like I don't want to do that because this. So I have patients who say, I'm not that old. It doesn't match my style." Actually, I had a few
Okay.
patients tell me
Yeah.
like, "You're aging me when you do these things." How do you encourage your patients to take on these modalities that can help increase their chances of living long and well?
I'll tell you, to your point, we get a lot of patients that fall,
Mm,
and then they go to rehab and they feel like they're better. They're home and they think that because I'm home, then I don't need to use my walker. But no, you do. And sometimes that is just having a conversation and then walking with them and showing them that this is the reality. I know that you're home, but here are the things that we need to do to keep you safe and to not go back to the hospital. And that's a big culprit. People do not want to go back to the hospital.
mm,
But
mm,
falling is probably one of the biggest things that
yes.
we get. Falling, getting off balance, and probably if someone had been there prior to help them with the balance issue to begin with on the front end, they probably wouldn't have failed, probably wouldn't have broken hips, all the things. And so now it is our job to help put some things in place with them. And that's a lot of family education as well.
Yes.
Again, sometimes there can be a lot of, kind of strife between family and patient. And I think that's everybody. We're all crazy when it comes to family, which is crazy. So, but it's getting in there and having those conversations, over communicating, talking about it over and over again sometimes.
I agree. And I want to buttress this point, the fall. Some people think, oh, I fall, I get up. Fall leading to a fracture is one of the most common causes of death in those who get hospitalized. The risk for a blood clot, right? The risk for an infection, and a lot of times they don't come back out the same. So we need to prevent that fall. And that's why it's such a big deal. I have patients who are like, I'm fine, I'll be fine. I'm like, no, we want to prevent you from falling, because what happens is not necessarily the fall, but the sequelae of that fall. That's even much more concerning. All right. Next, let me see. I'm going to have you, let me take this out. I'm going to ask you, I'm going to move over to you because we're going to talk speech therapy some. Jenny,
Yes.
how does speech therapy, for someone who's like, I didn't have a stroke.
Right.
I'm fine. So what? I cough a lot at night sometimes, or my teeth don't work as much. But so let's talk. How does speech therapy play a role in supporting seniors' communication and swallowing abilities?
Sure. So you're absolutely right, doctor. 9 times out of 10, if a patient has a speech therapy order and a speech therapist goes in to evaluate them, they say, "What the heck? Why are you here? I do not need speech therapy." So there are some misconceptions surrounding that, which I know we'll talk about a little bit later. But the biggest takeaway is just that comprehensive evaluation process. So even if a patient doesn't have an extensive medical history, or for those of you who are watching, you may have some difficulties at home where you're seeing over time, as we get older, they become more difficult, So we work on those things. To name a few, word retrieval, right? So someone who has short-term memory loss, someone who might start becoming more forgetful in areas of problem solving. What do I do next? You could be as high level as leaving the home and doing a routine driving activity, like going to Walgreens to pick up, detergent, and you might be on your way back and think, do I turn right or left? And it's important for us to normalize that and understand that might not always come with a formal diagnosis right away. And the reason for that, in my opinion, is because not a lot of people go through the extensive testing with the cognitive standardized tests in order to see, okay, exactly where are our areas of deficit, so that we can work on those, so that we can, if not improve in those areas, because everything gets harder over time with age-related debility. If we can't improve it, what can we do to decrease the likelihood of the worsening condition? Or what can we do to maintain our current status? So 100% cognition is missed a lot of times. There's kind of that stigma around, I don't need cognitive therapy, I don't need speech therapy. But it's more complex than that in the evaluation process, and we'll be sure to meet you on your level. It's the same with swallowing. We don't only see patients with a G-tube after a stroke who we need to wean off, in performing electric stimulation tasks to regain their swallow function. You might just be having pain during swallow, or a difficulty chewing or swallowing. So we work with a lot of speech and language related disorders, to name a few, dysarthria, which is just overall weakness and lack of coordination with eating. So it can be very minimal, and if we nip it in the bud in the beginning, then there's ways we can maintain the current function, if not get better.
Awesome. Thank you for sharing that. Now we're running low on time, but I'm still going to ask a couple of questions. Can we talk about success stories? And I want each of you to kind of speak to it. Like, what memories come to mind of successful? Oh wait, before we go ahead, I have a good question. This is actually a good one. Does insurance cover this for seniors? What would you say? Yeah, that's a good question. Does
Yeah.
insurance cover this for seniors? What would you say?
Do you want to speak of
So
it,
they
Mercy?
they so they do, just depending what insurance you have. So Medicare definitely covers it. Now you can see therapy in different ways, whether you're in a facility or at home, like through home health, or what we do is outpatient therapy at home, or you can go to an outpatient facility in a clinic. But insurance does cover it. Different insurances cover it to a different degree. But yes, it's definitely a covered service.
Yeah, you just have to figure out which ones your insurance covers, and then you
Covered.
can, which
And
ones they
we'll
cover
take
and go
that
from there.
off too. In the instance that there ever is that concern, we
Mhm.
have obviously that team where we would run the funding verification and make sure that the person knows that upfront what those costs would look like.
Yeah,
Yes, yes, that's
absolutely.
fair. That's fair. All right, so let's talk success stories. So for each of you, where therapy intervention significantly improved a senior's quality of life while aging in place. Sorry about that.
I can start. I can think of a patient that I just discharged. Maybe that was maybe 3 weeks ago. And this is a unique case because the patient was on hospice when they called physical therapy in.
Wow.
And typically with hospice, they might say therapy just come in and educate the family on what range of motion or whatever. But in this case, the patient's comfort level was to be able to get out of bed, and she hadn't been able to get out of bed because she was having a lot of breathing issues and orthostatic hypotension. Blood pressure was dropping whenever she tried to sit up or stand. So then she ended up on this path on toward hospice. So for physical therapy coming in for a lady that was really motivated, I was able to work with her to get the right equipment as far as a wheelchair with elevating footrest that helped her to be able to tolerate sitting with her legs up, compression stockings, and educating the family and the staff. This was an independent living facility or assisted living facility. So educating the staff on she must have her compression stockings on, she must have her legs elevated, and then being able to increase her sitting tolerance and her standing tolerance. She wasn't doing these things independently, but we went from bedbound 100% eating her meals in her bed, kind of crying and getting toward depression of like, is this life? To meeting her goal of being able to sit up and tolerate eating in the dining hall with the other residents and getting her hair washed. She wanted to go to the salon. So she was able to tolerate a 45-minute hair appointment, get her hair curled and washed and all of that. So it was such a good journey of 8 weeks with that patient and her family. And I know that that was the comfort care that she needed.
And I can testify to feedback from patients who have sent to your team, who have been able to do things that they didn't think was possible. So it's amazing the change in quality of life. So thank you all for what you do. All right,
Thank you.
Nadia, I'll let you speak.
I'll have to say, I think one of the many, because we have often many,
Right, right.
but one of the ones that come to mind is we have a patient who was off balance, who was falling, also had some cognition issues. I think actually that maybe Jenny saw this patient first. I think Mercy was initially out seeing the wife. Then we recognized that, hubby looked like he may have some issues too.
Hmm.
I was called in as OT. We were able to educate the family, see the husband and the wife, start educating the wife as she got better, so that because she was really doing a lot more caregiving with the husband.
Hmm.
We stopped working with her. We kept working with him, and while we're still working with him, we're still educating her. She's still doing good. She's maintaining, and then I think we all discharged them. And then maybe a month later, they said, "Hey, well, looks like we need you to come back." And so the doctor immediately, they reached out to the doctor. He called us. We came back out, and there is just a continuity of care going on. And that is the thing for us that is really the successor. Is there a continuity of care going on, not just for the patient but for their family? Even with the doctor, he knew to call. He was happy with what happened last time. We kept him looped in, and then everybody's winning. Everybody's winning. The doctor knows what's going on. the patient is empowered, the caregiver is educated, the family's educated, and everyone's winning.
I like that. I like that. Everyone is winning. It's a win, 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 win,
Yes.
win. Some more
Yes.
win. I like
Yes.
it. I like it. All right. Jenny, you go ahead and share a story.
Yeah, I'll speak quickly because those were beautiful stories. But I would say there's so many instances as far as the biggest takeaway from success with people aging at home is, like Nadia mentioned too, just that comprehensive approach. So from the beginning, Mercy saying, Jenny, this patient needs a cognitive evaluation, but they won't tell you they do. To Nadia, getting involved with increased confusion. Say we had a higher level patient who lives at home recently. He could have easily had to go to an assisted living because it was his wife's health was deteriorating, taking care of him. It was killing her, and we hate to see that. And this man's cognition, his confusion decreased overnight. He became so much more confused. Well, red flag, right? So Nadia communicating with myself, Mercy, getting on the phone with the physician, you doctor, ordering some labs, getting that involved. Turned out the patient had a UTI, this one specifically. Once he was on antibiotics, he just did a turnaround. That man could have been in an assisted living, by the time that happened. So really just that comprehensive approach would be my takeaway for the success story.
I like it. I like it. Now, before we wrap up, how can you encourage family members and their caregivers to actively participate in supporting seniors therapy goals? Like, how would you, if you could speak to their family members, what would you say to them to help foster this environment where all of this can happen for the patient and they can improve their quality of life? What would you say to that?
I would say just trying to find balance of trying to offer reverence and then still allowing them, and you're remembering that they're a person.
And they're adults.
Yes, and they want to be functional and still having a say about what goes on with them. And that is our job to ensure that happens, to ensure that they don't lose their voice. That's our job.
I like that, to ensure that they don't lose their voice, their independence, their sense of self-worth. Okay.
I have to piggyback all that and just say getting the family and members involved in the beginning is so important, because to see how their functional level of performance is that day when we do the eval to our goals for them, and then the resources that they need. It won't be just us, right? And so we have a lot of connections, and we have to connect them to the right people and make sure they have that level of involvement with caregivers. If it's 8 hours, we need to connect them. If it's 24 hours, we need to connect them based off their cognition. So really just involving the family as much as they're willing to be involved in the beginning, and going from there.
All right, awesome. Mercy, do you want to add something else?
They covered it. I think my only other thought was just being very active and proactive, and being the eyes and the ears and the kind of remembering mind for the different cues, whether it's postural cues, like you hear us say all the time, look up, shoulders back, all the things, but if no one is watching exactly, it's so easy to fall back into it. So as an outside eye, they can say, hey, mom, or hey, dad, sit up tall, don't forget, or do your exercise, or take your pain medicine so we can do this, things like that. Just those external cues, or helping with, one of the big things I see a lot is if the parent does have to move in with a family member, sometimes you don't want to change your furniture to accommodate family. I've seen it a lot. Like, you don't want to move that beautiful rug when that's the rug that could end in a fall, things like that. So really, really embracing what it means to support them at every stage. We get to help be that voice for them, that they, sometimes it's easy to skip over those things.
Wow, that's powerful, because sometimes the rug matches the curtains.
Exactly.
But it's really important to know what's really at stake, and so
exactly.
that the whole family is working together. Yeah. And one of the things I also want to emphasize, and all of you have touched on this and spoken in different ways with this angle, when you create a team to support your loved ones, having advocate for them, you don't always have to do the things, but you can create a team, a network of providers, caregivers, to help take care of that loved one, so the burden doesn't lie on you.
Yes.
Yeah,
And so sometimes it's
absolutely.
talking with the insurance companies, finding out, okay, who's a network. It can be a little hiccup, but there are resources out there for you. So that being said, ladies, I have people who are watching like, oh, my mom needs this, my dad needs this, I have an uncle, I'm going to forward this video to someone. Where can people find you guys?
All over. So we all have individual business names, but for me, the easiest way would be an email to info@merciestouchpt.com. I am on Instagram as well as on Mercy's Touch PT. Um, so that would be the easiest two ways to find me. I think email would be the best way.
Okay, email. Nadia?
And for me, I'm concierge therapy and wellness. I can be emailed at info@myctgroup.com, or you could just call me 972-207-4353, and I'd love to serve you.
All right, so my CT group, right?
.com.
.com. All right. .com. All right. And Jenny?
Yes. Mine is info, info, at Vincent, VINCENT, reboundnetwork.com. And you can call me too. my number is 618 697 4017.
All right. So I've put all the information at the bottom of the screen. I'm so excited about those who are going to watch this. I mean, those who watch live, thank you for watching as well. And those who will watch this in replay. It's amazing what we could do when we all work together for our loved ones. So this has been awesome. Thank you so much. I learned as well just listening to you all talk about this. It's obvious you guys enjoy what you're doing. And thank you for taking the time this Tuesday evening to spend with us.
Thank you for having us.
Thank you. And thank you for sending us your patients as well. You are an awesome doctor. I can say that thoroughly. So thank you. It's an honor to get to work with some of your patients for sure.
Oh, thank you. They love you, man. They love you.
Everybody loves Mercy.
Man, they love you. This has been good. And this was the first time we did the 4. It looks
yes, that was cool.
Like high five, virtual high fives. This is good. Strong work, beautiful ladies. Thank you all so much for what you do. Everyone who's watching, please, as always, sharing is caring. Forward this to those people who could use these services. Even if they don't get to work with us, at least they know what to advocate for. But it is possible to live a better quality of life, even as you age in place. Okay? That being said, thank you for hanging out with us. If you are looking for a good doctor in the Mansfield, Texas area who will help you live long and well and have conversations like this to help improve that chance, yeah, I am she. Have a good one, everyone. Thank you so much, ladies. This was good. This was good.
Thank you.
I'm going to do this again. So I like to ask live a couple of months so we can talk about, okay, how can I reduce falls, or how can I something in regards to this. I think it'll be good. Okay.
Awesome.
I asked live, so you can't say no.
That's right.
We'll do it. We'll be ready.
All right. Thank you, ladies. Have a good one.
Thank you.
Bye.
Thank you.
All right, bye-bye.